Hi guys, I'm Dr. Puja. This is Wesley Fofana. He's taken a really bad hit, really bad tackle. He's going to be out for about 5 to 6 months. Come, let's take a walk. Let's take a look at the medical perspective of things, and let's take a look at what he's going to face for the next 5 to 6 months. So Wesley Fofana is like a super athlete, but he too has to succumb to physics. He too has to succumb to the anatomy of his body. I mean, think about a light bulb. Shatter that light bulb. Literally, that's what's happened to his leg. Our bones do not like a torsional. They don't like to be twisted. And that's exactly what's happened here. So let's take a look at the video together. So right here, there he goes, right there. So right there, you can see his leg. It's in a twisted way. The other guy literally is putting his weight on Wesley's leg. So his ankle is literally going to be planted down, and all of that force is going to cause a torsional twisting force on his leg, and that leg is likely going to shatter. So he probably has a fracture of his tibia and his fibula. So the tibia is like your shin bone. I think he probably had a comminuted fracture, and that's the type of fracture that I talked about earlier where it just kind of shatters in many pieces. You're gonna need surgery. He likely is gonna need some type of a fixation. So a surgical fixation where they're gonna have screws, and it's gonna be a big procedure. He's probably gonna be out for about 6 months or so. He'll have physical therapy, he'll have rehab. This isn't an injury that he can just jump back from like right away. His return to play is gonna be like 6 months or so. So because this is such a horrific injury, like yeah, his bones twisted, his tissues twisted, his skin twisted, that type of torsional force on the skin causes a lot of edema, and that edema can lead to compartment syndrome. So compartment syndrome is no joke. It's a big deal. Your leg is gonna die. So yeah, so this video is from Dr. Ibrahim. He's an orthopedic surgeon. Awesome. I love his channel. I tell a lot of my ortho residents to go take a look there if they need to kind of review on their basics. So let's continue with Wesley. Because of all that soft tissue twisting injury pattern that we talked about, like the pressure in his lower leg can increase so much that that can actually require him to have an emergent surgery. And the surgery that we do for compartment syndrome is a fasciotomy, basically. So let's take a look at what a few of these legs can actually look like. Yeah, so literally they had to cut this part of his leg to relieve the pressure. And once that pressure has been relieved, that leg literally has been saved. So this is a life-saving procedure. Let's take a look at some more. Yeah, I mean, the critical right here, time is critical in compartment syndrome. This is something that is honed into every orthopedic surgeon, every PM&R student, every family practice student, like every person who has ever taken care of a leg. And if they're a doctor, they know this diagnosis, and you don't want to miss this because that person will lose their leg if you miss this. So Wesley's going to be under good care. I mean, he's going to have the best doctors working with him. So I'm not worried that Wesley's going to develop compartment syndrome. All right, guys, so the next step in Wesley's journey is going to be physical therapy, a lot of rehab, and pain management. That's going to be a significant portion of his recovery. So here in the United States, we really try to minimize the use of opioids because they definitely can lead to addiction. There's a huge opioid crisis here, but I mean, you still will likely get prescribed opioids. I mean, that's usually for about a 3-day period or so. Then there's gabapentin, there are tricyclic antidepressants, you have acetaminophen, and you have NSAIDs. Let's review again. Let's take a look at his injury again. Painful injury. He's likely had a comminuted fracture. He's likely fractured his tibia, maybe even his fibula. He may have a lot of soft tissue injury as well. He's going to be out for 5-6 months. This is going to be a long time. He's going to have a lot of physical rehab, a lot of pain management ahead of him. But his spirit is still young, and we all wish him the best, and we know he's going to do well. So here in the States, football is an entirely different thing, but we do have family that's all over the world, and we all want to say hi to Ronaldo. Bye!